Hello! Today let's dive straight into the topic. First of all, because it's important, useful, and I haven't found anyone presenting it fully, concisely, and practically like this. Also, because there's no need for introductions, we all know what obesity is, its harms, how to calculate your body mass index, and what are the best, safe, and effective medications that actually help with weight loss. I explained all of this in my last video, the real magic weight loss medications. If you haven't watched it, I'll leave the link in the description, so watch it after this one. Now, let's get straight into the topic and discuss what options are available if your belly is bothering you and you've tried diets, exercise, and even medications, but haven't seen results. What are the key differences between them? Which one might be the most suitable option for you if you need it? And finally, I'll give you 7 very important tips if you're considering any of these procedures. Believe me, after watching this video, you'll know everything you need to know about this topic. I'm Dr. Charles from the Doctor Program on the Truth Channel. So if you've decided to look into these weight loss surgeries and see which one might work for you first, you should know that we have 2 main types of surgeries. Surgeries aimed at weight loss for people with extreme obesity, like gastric bypass, sleeve gastrectomy, gastric banding, balloon procedures, and others. Surgeries primarily for cosmetic purposes, although they can lead to some weight loss, they are not designed to treat obesity, such as liposuction or body contouring with ultrasound and laser. So what's the idea? When you eat, your stomach can hold around 2 liters of food and drink on average. Some people might even fit a whole sheep in their stomach. After eating, it stays in the stomach for about 3 or 4 hours, during which it breaks down into smaller components that your body can absorb and use, and then it moves into the intestines. The intestines are where the nutrients and calories are absorbed, which contributes to the growth of your belly. So we have 2 main options to help you lose weight: either shrink the size of your stomach, which can sometimes be reduced to as little as a quarter liter after certain procedures, or we can reduce the absorption of calories by rerouting part of the digestive system. This is called malabsorption. Of course, the risks of malabsorption are significant, so there's usually no surgery done solely for malabsorption. These surgeries are usually a combination of both reducing the stomach size and rerouting part of the intestines, which decreases absorption. There's also a third option, which is newer and considered better than the other 2, inserting an electric device that interrupts the nerve signals from the stomach to the brain to reduce hunger. Let's go through each one, starting with restrictive surgeries, which shrink the stomach. The gastric banding procedure, for example, involves inserting a band around the upper part of the stomach through a small incision. This divides the stomach into 2 parts: a small pouch at the top, where small amounts of food fill up, making you feel full after just a few bites, and a larger section at the bottom, where food moves through more slowly. The advantage of this procedure is that it's relatively simple, with no cuts or major incisions. The band can also be adjusted after the procedure if necessary. It's even reversible, meaning you can have the band removed later if needed. However, the weight loss after this procedure isn't as rapid or significant as some other surgeries. Also, many patients experience difficulty with eating after the procedure, especially if they were used to eating large quantities. If they try to eat too much, they may feel pain or even vomit. You'll also need to follow a strict eating plan to avoid discomfort. A significant disadvantage is that the stomach can stretch over time and weight loss may plateau. Some people might even regain weight after a few years. The other potential issues, such as complications from the surgery itself like infection or bleeding, can happen in any surgery, but these are rare. Now let's talk about the sleeve gastrectomy, which involves removing about 3/4 of the stomach, leaving a narrow tube-shaped stomach. This procedure typically leads to much greater weight loss than gastric banding, with patients seeing rapid results in the first few weeks. However, it's irreversible. Once the stomach tissue is removed, it's gone for good. Moving on to gastric bypass surgery. This involves reducing the stomach size and bypassing part of the intestines to reduce absorption. The most common type is called the Roux-en-Y bypass, where the stomach is divided into 2 parts and the upper part is connected directly to the small intestine. This means the food bypasses the stomach entirely and doesn't stay there long enough for full absorption. The result? Significant weight loss. Gastric bypass also helps with obesity-related conditions like type 2 diabetes, joint pain, back pain, and respiratory issues, which can improve within months after the procedure. The main advantage here is that it's difficult to regain weight, unlike the other surgeries. However, as with all weight loss surgeries, there are risks like nutrient deficiencies, which may require lifelong supplementation of vitamins and minerals. There's also a condition called dumping syndrome, which occurs when food rapidly passes into the intestines without being properly digested in the stomach, leading to symptoms like dizziness, nausea, sweating, and stomach pain. The key to managing this is adjusting the type and amount of food consumed. Finally, there's the vagus nerve blocking procedure, which is a non-invasive method that works by disrupting the hunger signals sent to the brain from the stomach. This can be done through a device placed in the stomach or by freezing the vagus nerve. This procedure has shown promise for long-term weight loss maintenance, although studies on its long-term effectiveness are still limited. Most of what I found were patients sharing their experiences and how they actually lost weight during the first year. The weight loss was smooth, and importantly, they didn't feel hungry. They didn't go through the suffering of eating and then throwing up, which we talked about regarding the various types of gastric surgery. But be careful, because the vagus nerve is responsible for other functions in the body. When you block it, it affects some digestive functions and the movement of the digestive system. Many people who undergo this procedure complain of issues like indigestion, bloating, acid reflux, and similar problems. I won't even mention technical issues, like when the battery of the device runs out. Seriously, you'd have to go back to the doctor to get it replaced. Or like when your nephew takes your remote and literally messes with you. Now we've covered the main, popular weight loss surgeries, and as you saw, most of them are done through a small incision in the abdomen while you're under anesthesia, and a camera is inserted to perform the procedure. But there are some other popular methods that people like, and some of them actually show good results without any incisions or surgeries, like what? The gastric balloon. This is probably the most famous one. It's a thin tube inserted through your mouth without surgery or any cuts. It's not like the abdominal camera we talked about, which enters through a small incision in your belly. Here, the camera goes through your mouth. The balloon is inflated with a solution like water or even air, and once it's in your stomach, it's left there. So you constantly feel that your stomach is full. After eating something simple, you'll feel full immediately. This is a restrictive procedure, restrictive surgery. The best part about the gastric balloon is that it's a very simple procedure and it's completely reversible at any time. You can remove the balloon if you want, inflate it more to fill your stomach more, or even add another balloon if needed. It's one of the simplest procedures, although calling it a procedure may be an exaggeration. However, of course, it has drawbacks. For example, the balloon is temporary, so after 4 to 6 months, or up to a year at most, you'll have to remove it. Also, its effect on weight loss isn't the strongest. Most people lose about 10% of their body weight during the 6 months the balloon stays in their stomach. But the bigger problem is that, as we said earlier, your stomach can enlarge over time with food. So when you remove the balloon, your stomach may be much bigger and without the balloon, causing you to eat more than before the procedure. Procedure for constricting the stomach. This is another method involving inserting a camera through your mouth to wrinkle specific areas of the stomach, making it smaller. The idea is that this part of the stomach helps release hunger hormones, so it reduces your feeling of hunger between meals. Not only does it shrink the stomach, but it also reduces hunger. It also keeps food in your stomach longer, so you feel full for a longer time. This procedure is simple, fast, and has fewer side effects than other methods. However, its effect is not as strong as some of the surgeries we discussed today, and you may not find it common in your country as it's less widespread. The butterfly procedure. This is another type of gastric restriction surgery where the surgeon stitches part of the stomach to make it look like a butterfly. The surgeons who perform it claim that its complications are fewer than others, but honestly, I haven't seen any reputable scientific sources or international associations talking about it. Most of what I found were just experiences shared by some doctors on news or research sites that are not very reliable. So I don't believe it's proven or its long-term effects are well understood. If anyone has tried the butterfly procedure and benefited or suffered from it, it would be great to share their experiences in the comments. Botox injections in the stomach. What's the story with Botox injections in the stomach? Here, Botox is injected through an oral camera into the stomach wall. You're familiar with Botox's famous use for relaxing muscles in the face to eliminate wrinkles. Well, Botox works the same way in the stomach. It relaxes the stomach muscles, reducing its movement. This movement is what normally pushes food through the intestines, emptying the stomach. So when Botox works after 2 or 3 weeks, you'll feel like your stomach is full all the time. You'll eat less and feel full faster. Is this a good or bad procedure? Honestly, I can't say it's really a procedure, and it's not officially recognized as a treatment for obesity. I mention it because it's trendy, and some people actually lose weight from it. But no respected scientific organizations recommend it, and it doesn't lead to significant weight loss, usually less than 10% of body weight at best. It's kind of a mix between a drug and a procedure. It doesn't involve surgery or placing a balloon in the stomach, but it's still not as simple as taking a pill or getting an injection under the skin like the medications I explained in the previous video. However, the Botox injections would need to be repeated every 6 months for sustained results. Now, I know you're tired of all this information, so which one should you choose? As you saw, there's no one-size-fits-all procedure. Each one has its advantages and disadvantages, and it depends on how much weight you need to lose, how fast you need to lose it, whether you're ready for a procedure with no going back, or if you want something reversible. Of course, the cost and availability also vary from place to place, and you need to consider your health and whether you can handle full or local anesthesia or any contraindications for certain methods. At this point, I really want to give you the top 7 tips to keep in mind if you consider any of these weight loss procedures. Exercise. Weight loss surgeries are not simple, no matter how simple they may seem compared to others. There's a risk of complications during or after the procedure, and patients who are overweight have lower emergency reserves, meaning complications, even from a simple allergy, can worsen quickly. The weight loss surgery business is huge, and you'll see discounts similar to supermarket promotions. Yes, these procedures can change lives, but you're not buying a dress. This is a serious medical intervention. The skill and experience of the doctor or surgeon is not measured by how often they appear on TV with flashy ads. Just because a doctor is featured on a show doesn't mean they are necessarily the best. Avoid doctors who claim 100% success rates or 0% complication rates. No procedure is without risk. Be cautious of doctors claiming to have invented a procedure or device. Procedures are tested on thousands of patients before they're approved, and no new device is without side effects. If you decide to undergo surgery, make sure it's at a reputable hospital. Don't cut corners when it comes to your health. The hospital must have well-equipped operating rooms, high-capacity tables, intensive care, blood banks, labs with fast results, and 24-hour imaging services. If these aren't available, you're putting your life at risk. I could keep going with tips, especially since this field has both many benefits and many hidden scams. But let me brace for the worst. See you in the next video. Goodbye.